episode number 314 of the Wholesome Fertility Podcast. My guest today is Dr. Jeffrey Gross. Dr. Gross graduated from the University of California at Berkeley with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 1992 from the George Washington University School of Medicine, and he contributed to virology research during his studies. After graduating, he undertook a residency in neurological surgery at the University of California until 1997. He then pursued a fellowship and chief residency in spinal biomechanics at the University of New Mexico until 1999. Licensed in California and Nevada, Dr. Gross has spine practices in Orange County and Henderson, Nevada. A trained neurological surgeon, he specializes in athletic injuries and spine procedures and offers longevity and biohacking consultations. He achieved board certification by the American Board of Neurological Surgery and is a member of several prestigious medical societies. He has written textbooks and articles in his area of expertise and is a peer reviewer for the state of California and a scientific journal. Since 2020, Top Doctor recognized Dr. Gross as a leading neurological surgeon. He also received Health Tap's 2022 Top Doctor Award as a top neurological surgeon in the U.S. Dr. Gross founded Recelebrate, focusing on anti-aging and regenerative medicine. The mission for Recelebrate emphasizes offering modern biochemical treatments and considering surgery as a last resort. What piqued my interest about this is that this can be used for anti-aging, and it can also help possibly with lowering inflammation and possibly improving fertility health overall. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the podcast, Dr. Jeff.
Thank you so much for having me. Nice to see you.
Nice to see you as well. So you definitely have a very long, impressive background. So I'd love for you to share your story on how you got to the anti-aging stem cells work that you do. So I'd love to just get a quick background so the listeners can hear.
Sure. Thank you for that. It was by accident of sorts, maybe directed accident, because I was practicing as a spinal neurosurgeon, taking care mainly of neck and back trouble, some other neurological issues, nerve problems, things like that. But my practice was highly consultative, a lot of opinions, second opinions. I was seeing patients who had neck and back problems that were perhaps mistreated or not fully treated elsewhere, and I was kind of a catch-all for that. But my patients came to me one at a time, and these are patients that had tried different things and they just didn't work adequately, like physical therapy, like anti-inflammatories, like rest, like chiropractic, acupuncture, maybe spinal epidural injections or things like that. And they'd come in and say, well, help for a minute, but it just wasn't enough. I'm still having a lot of trouble with my neck or back or pinched nerve or whatever. And I'd say, well, the next thing on the menu is to talk about surgical options. And they'd say, well, I'm not that bad. So wait a minute.
Yeah.
I'm like, okay, good. Because I was hoping you would say you're not ready for that, because I really didn't want to offer that to you, because I've always been on the slow to operate side of things. So a lot of them would say, well, how about lasers, or how about herbs, or how about cannabis, or how about stem cells? And I heard the stem cell one more than once. And chance favors the prepared mind. So my undergraduate background is in molecular cell biology, which is kind of the stem cell, root of stem cell biology. And, when you get whisked off from undergraduate to med school and residency and practice, you don't really get to apply that cool science. So the nerd part of me took over and said, I wonder what's happened in all these years since I went to undergraduate, So instead of going to the stodgy neurosurgeon convention every year, or more than one, where the same people pat themselves on the back for saying the same things for decades. I decided I'm going to open my mind and start going to stem cell and regenerative medicine meetings
Hmm.
so I can offer this to my spine patients. So I did that, and I not only brought back a new tool to offer them, but it blossomed into so much more. You can't get access to regenerative medicine, stem cell medicine, and I'm using those phrases sort of interchangeably here, uh, and not say, "Oh, I'll help your knee or your ankle or your shoulder or your autoimmune issues or other hyper-inflamed states," or you read more and you see accumulation of inflammation is really the aging process, and if you can fight against inflammation accumulating, you're fighting against aging. So the whole
Hmm.
anti-aging
Yeah.
umbrella opened up, and here I am 6 years later, where spinal medicine is only a small percentage of my practice, and I love it.
That's great. So for people listening, some people might be like, okay, I kind of heard about stem cells, but what exactly are they? So just for people listening for the first time, really not understanding that aspect of like what they are, because we hear about it a lot. And
Yeah.
over the years, like you said, stem cell research has really drastically changed and has gone into so many different things. Sometimes we hear about like, back in the day about them growing a liver, or like,
Yeah.
the possibility of growing
Yeah.
organs through stem cells. So
Yeah.
for people who are really new to this, I would love for you to break it down.
Sure, let's do stem cell 101. That's great. So and being a fertility podcast, this is relevant probably more than any other area of medicine, because fertility and creating an embryo is creating a group of stem cells that divide and grow into a fetus who's made of all stem cells, right?
Right.
And then that fetus is born, and it's a baby, and the baby grows for 18, 20, 25 years, whatever. And that growth requires stem cells. And then after that, an adult has to maintain, has to replace, has to restore, has to regenerate. And that requires stem cells. So, what are these? They are cells from which other cells arise, from which other cells stem from.
Mm.
Okay, so and they are powerful because there are different types, right? We throw out the phrase stem cells, but when you're a one cell or a two cell or a four cell embryo, you have these omnipotent cells. They can form any part of your body. They are amazingly powerful. As those divide and differentiate, meaning take on some specific characteristics, they become less powerful and more directed, and those are called a pluripotent. And a pluripotent might be able to regrow a limb. And as you and many of your listeners probably know, there are certain species that can still do that, like a starfish. You cut off a leg of a starfish, it can regrow it, or a tail of a lizard, or a limb of an axolotl, which is a strange iguana-like creature from Mexico. So there are many examples in biology where these pluripotent stem cells can be called upon. And you mentioned maybe regrowing a liver someday. That will probably require some knowledge of pluripotent stem cells, which are being looked at. However, um, after these stem cells sort of retain, we bank them in our body as adults. Those are called multipotent. So they can't regrow a limb. They can't regrow an organ per se, although they can replace some organ cells and regenerate. And we're always replacing cells. We're replacing skin cells and hair follicles and all kinds of things. That requires stem cells. If you have an injury and you cut yourself, you require stem cells to help come repair that.
Mm.
And we make new blood cells all the time. That requires stem cells in our bone marrow. So we are using our stem cells. This is not new. We just know more about it now. And the whole move in regenerative medicine is to take a lesson from that biology and use it strategically to help somebody do something they need.
So interesting. So give us a couple of examples on how it works in the body. like
Well, the
for somebody who needs it, for example, or as like a therapy?
right. So the low hanging fruit, as an example, are joint degeneration, um, also called arthritis or osteoarthritis, vaguely, or some people it's called bone on bone if it's bad enough. Right. And these are painful joints. It could be from an old injury, an old arthroscopic surgery. It could be from just accumulated wear and tear. And this is a problem with the joints where the cartilage is worn down, and the joint is painful. You can't use it as well, stiffness, etc. And it slows people down. And when you slow people down, particularly in their older years, they're less mobile, and then they can't maintain their bones, their bone density, aka the one way to fight osteoporosis is weight bearing exercise. So if you can't,
Right.
if your joints hurt, you're not going to do it. And muscle mass, because both bone density and muscle mass are correlated with longevity. So if you keep moving, you maintain your muscles and bones, you'll live longer, statistically. So in any event, we want to preserve joints, and that's kind of why I got into this field. I'm a structural guy of the spine, and it easily extrapolates to the other joints. And most of the research, the well-published research, comes from knees and other joints. And just parenthetically, most of the good published research that we follow, because we're not just shooting from the hip here. We do shoot some hips, but uh, comes from Asia and Europe. The United States is behind, although we can do these things, and we can talk about that later. But the short of it is, we have a really good track record of helping people with degenerated joints, in reducing pain, in improving function, and we do have some examples with where we've done some MRIs before and after, and the after MRIs have shown some regrowth of like knee cartilage, for example, and things like that. So we're not allowed to make any claims because we're not yet approved for marketing claims, but I can show examples, and I have to say, like, you invest in stocks, past performance does not guarantee future results or something like that.
Right.
But
And
in
each
medicine,
person
it
is
never.
different and you
Yeah,
need,
yeah.
yeah.
But anyway, it's better. Listen, if you want to try to avoid a joint replacement surgery, it's worth looking into. So whether it's spine or joint, so that's the easy stuff. Low hanging fruit, I call it. The
Hmm.
the other stuff is anything with an inflammatory problem in your body can potentially have benefits from regenerative medicine on its face being a natural anti-inflammatory.
Right.
So, for example, autoimmune problems with hyperinflammation, like rheumatoid arthritis, thyroiditis, inflammatory bowel syndromes, MS, things that have an inflammatory component. Also, most diseases of aging are diseases of inflammation. So,
Hmm.
coronary artery disease, Alzheimer's, things like this all have an inflammatory component, and this allows me to overlap into your area. Is There are some causes of fertility issues that have an inflammatory component, whether it's a uterine issue or ovarian failure, and sometimes fighting that inflammation, whether it's through lifestyle changes, diet, exercise, mindfulness, sleep, reducing mental stress, all those things can help reduce the inflammation and help potentially lead to successful, pregnancy. The same can go for use of regenerative biologics like stem cells, and they're not the only thing we use. And there are wonderful publications. And before we got on this, I refreshed my knowledge by doing a little homework. And there are even newer publications on use of these things to improve fertility. Now, most of these are from China because they are way ahead of us.
Right.
So, but that doesn't mean they can't be applied here outside of China.
Interesting. So interesting. So how do they get these stem cells?
So, stem cells and other related biologic material in the US comes from a well regulated donor program. Typically, the donors are women who are planning to have a C section. Some of the labs even recruit the donors in the first trimester, make sure they're having a healthy pregnancy. They're not using substances they shouldn't be using. They take their prenatal vitamins. They're not in any high risk behaviors. And at the time of the C-section, they simply, and once the mother is congratulated with her new baby, they take the amniotic fluid, they take the umbilical cord, they take the placenta, and they put them on ice in a sterile fashion, and they go to an FDA compliant certified lab that can test and screen the materials, make sure
Mm-hmm.
there's nothing in there, no diseases, no problems, and then make it available to clinics and end users like myself. So there are myths, that all kinds of crazy stuff are happening out there, but not here in the U.S. We use highly regulated donor processes.
When you have the stem cells from donors, can they be multiplied, or is it just like a finite amount? Whatever is there is there.
They can be. There are labs that put them in culture, let them grow and divide, and that's one thing that can be done. Now, just like anything, a copy of a copy of a copy tends to lose its vitality. So, things like telomere length, which is an
Mm-hmm.
aging marker, that changes with each division of a cell. So I don't like to use divided material. I use just fresh, first pass stuff. If maybe your listeners are a little young for this, but there's a really funny movie called Multiplicity, where Michael Keaton clones himself, and each clone is a little bit wonkier than the original. So you want to, if you want a
Comedy
good
used
laugh,
to be so much better.
yeah, yeah, yeah. Check out that movie. But in short, I prefer the actual native original cell
Right.
when we
Got
do
it.
cells. Yeah.
Is this similar to cord blood? When the baby's born and they say, you can opt to do that and then store it.
Yeah, let's tap into that for just a second and unpack it if it's okay.
Sure.
Historically, you would be offered to donate or not donate, but store your umbilical cord, and that the purpose of that was, God forbid, your child gets leukemia in 7 years, you have a matched set of cells that they culture, they do divide,
Mm-hmm.
actually,
Right.
and replace the child's bone marrow. You don't have to worry about a donor or a match. Now you can do that, and you can also use, in some labs will use those umbilical cord cells as a source for any other future purpose, whether it's a joint problem or what have
Mm-hmm.
you. They're now doing that. In fact, you can use that for family members as well. So the reasons for banking your umbilical cord, and they probably won't tell you in the pamphlet because it's not yet approved for marketing claims, is
Mm-hmm.
much more than just in case there's a case of leukemia, you need a full bone marrow replacement.
So interesting. So how, when you do have the stem cells, first of all, it must cost a fortune. It sounds like, because it's limited. It's not something that because you're depending on donors.
No, well, there's a little bit more to it, and I keep using the phrase stem cells and other biologics. Let's talk about other
Okay.
biologics for a minute, because some of these other biologics are less expensive, and here in the U.S. it's affordable. You don't have to necessarily leave the country and go to Central America or
Mm-hmm.
Hong Kong to get this, or Europe. A lot of the professional athletes historically went to Europe, but they're getting it here in the U.S. too.
Oh, that's good.
Um, but we found out that if we gave you stem cells, let's say you came over and I hooked up an IV and we gave you stem cells, in 10 to 14 days, those would be out of your system.
Mm-hmm.
However, the benefits would go on for weeks or months, or even some of the benefits would be, prolonged. So why is that? If the stem cells are gone, what's going on? Well, it turns out the stem cells aren't really doing all the work. The stem cells are delivering cell to cell communicating and influential biomolecules, peptides, growth factors, small RNAs from the stem cells to your cells, reinvigorating and activating your cells to do that work. And those communication packets are called extracellular vesicles, or for short,
Mm-hmm.
exosomes.
Mm-hmm.
And you may have seen this, a lot of estheticians use them. They can add them to your microneedle facial. It's
Mm-hmm.
sort of an advanced vampire facial with these exosomes. So the exosomes are probably doing most of the work that the stem cells were doing. And there are advantages. They penetrate tissue better. They're easier to store and handle. They'll cross the blood-brain barrier if you want them in your brain and nervous system, and they're less than half the price of stem cells. So we can do things that used to cost $20,000-$30,000 out of this country for less than half of that here, because the big cost is the materials, these biologics. So what does it cost was your original question, but now that we're using these exosomes preferentially in a lot of these cases. And by the way, as an aside, all stem cells, sorry, start over. All cells make exosomes.
Mm-hmm.
We're using stem cell derived exosomes from amniotic fluid, which is quite abundant.
Mm-hmm.
So there are really no cells in this. There's no matching that needs to be done, and it's wonderful. So for example, treating a knee, if we're trying to repair a knee, help someone heal a knee, we're asking their cells to do the work. We're just providing the re-instruction to tap back into the original factory that made that joint in the first place. And something like that is kind of two doses of biologics, one above, one below the knee, with the injection, the facility, and everything where we do it is sterile. All that is, in the 9 to 12,000, depending on what we're doing. So
Mm-hmm.
it's not crazy. And IVs, if we do an IV, that's anywhere from like 4,000 to 8,500, depending on the dose.
And how many times would somebody have to do that?
Maybe once. Usually the joints are one and done, and then they
Mm-hmm.
go back to their normal wear and tear. So is it
Mm-hmm.
possible someone's going to come back in 20 years and need it again? Maybe, but that's okay. We follow a French protocol that has published 15-year follow-up, and we follow that protocol, how they do it. And they've had over 82% of the patients had wonderful results at the 15-year mark. We're waiting for them to publish the 20-year mark. So we're not making this up. We're just duplicating what's already been done in good
Mm-hmm.
science that's out there.
And for inflammatory conditions, autoimmune conditions, or even fertility, well, because it's secondary to that a lot of times,
Right, right.
um, do you use IV? So
Yeah, I
really
would
get it right
definitely.
into the bloodstream.
Oh yeah,
Okay.
yeah. And that's how we approach anti-aging anyway. People are biohackers, anti-agers that
Mm-hmm.
come in. This is what we do. And we do an IV. We try to figure out a dose that makes sense for that person based on the budget and their age and maybe their inflammatory markers in their blood tests and other things. And then we see how long it lasts. And some people get a year, 2 years. Some people get 6 months. Some people come in preventatively and do every 3 months a lower dose. It just we customize it for the individual.
And that crosses the blood-brain barrier, so it's good for brain health, really
Yeah.
for just everything.
Anywhere
The system.
there's an inflammatory burden,
Mm-hmm.
we'll do it. So, but exosomes do cross the blood-brain barrier. And let me go off script here for a second. For listeners that have been pregnant before in later trimesters, a pregnant woman has glowing skin and her hair is growing wonderfully. And typically, there's not a lot of joint pain, maybe low back pain from carrying the weight. But why is that woman in not having this great skin and all that? It's because that woman is getting a daily dose of stem cell derived exosomes, because they also not only cross the blood brain barrier, they cross the placental barrier. So
Mm-hmm. Got it.
what we do is almost simulate that in a single dose.
That's so interesting. So in that case, when you are doing IV, is that also one and done?
No, like I was saying, it depends on what benefits someone gets and for how long they last. Like it
Oh,
could
I
be
see.
depending on the person's need. Now, if it's someone who's got an inflammatory problem and they're just trying to get pregnant, it could be a one and done.
Mm-hmm.
You know,
Got it.
if it's someone that has benefited from it and wants to do it repetitively, then we would help support that and make it available.
Have you heard of this being used in injected directly into like uterus or those areas, or is it typically more like IV?
So not into the uterus, although there are examples in men of injecting the testes where they're not producing adequate sperm counts.
Mm-hmm.
Um, I think IV would be a
Or
first.
ovaries, maybe?
So I didn't read anything about ovarian injection yet, Could that be coming? Possibly.
Mm-hmm.
IV is obviously an easier thing to do. So I would try the IV first. But you're right, you're going to get a higher dose if you inject directly. That might be, something to look at. We haven't done it. We do have some sexual health shots we do at the exosomes now where we do P shots and O shots for men and women respectively,
Mm-hmm.
for improvement in sensation, lubrication, that
Mm-hmm.
kind of thing.
I know that they do PRP with the ovaries, and I think also uterus. So that's why I was asking because it's kind of similar. It doesn't have the same exact substance, but it's the idea of stimulating.
No, I completely agree with that. PRP is basically a very lower, it's the lowest end self donated
Hmm.
regenerative medicine.
Right.
And it probably contains some cells and some exosomes in there.
So interesting. That's really fascinating. So, for you specifically, like if people wanted to work with you, do they have to come visit you, your office where you are?
Not necessarily. So, most of what we do, we start out remotely. The vast majority of my patients come from somewhere other than Las Vegas, where I'm located, actually Henderson, Nevada, which is a suburb of Las Vegas. Most people start remotely. We do a lot of the blood tests, or if they need MRIs or what have you, remotely. And we only invite them to come to town if there's a reason to come to town. We do have some other colleagues in other parts of the states too that can do IVs and things like that. So we can sometimes refer. Um,
Hmm.
yeah,
It's really fascinating. It seems like
yeah.
state of the art. It's like the new thing that's coming out.
And there are things coming. If you'll allow me to just jump there for a
Oh,
second.
of course. Yeah.
We are working on some projects here at my practice. One of them involves exosomes that are stuffed with extra mitochondria.
Mm.
And for those of you that don't know, that's a small part within the cell. It's kind of a cell within the cell. We learned in high school biology it was the powerhouse of the cell. It made the energy, but it actually does much more. And some causes of infertility relate to poor mitochondrial activity in the cells of the ovaries and things like that. So we're looking at exosomes that could be overstuffed with that can donate more mitochondria. So that could be very useful. There are many other reasons to do that as well. And then we're even involved in a project that may be useful to help patients with cancer. And this is a particular exosome that comes from a certain type of immune cell, a T cell in our body, whose
Mm.
job is to identify, circulate around the body, identify, and then selectively remove or kill an abnormal cell like a cancer cell. So imagine that as an augmentative therapy or even as a preventative.
That's
uh,
fantastic.
yeah, so we're hot on that trail. That's coming soon to a Recelebrate clinic near you.
I love that. That's awesome. That's really amazing. And what have you seen so far in regards to fertility? Have you seen people do this treatment and it work? And with fertility, there's so many different reasons for why. I mean, it could be so many different. It's really a range of underlying conditions.
Correct.
But what have you noticed so far?
So honestly, I don't have a fertility practice. That's pretty far afield from
Yeah.
what I do. I do a lot of structural work, a lot of joints, a lot of spine. We do some autoimmune and a few other things. But I have talked to colleagues, fertility specialists, in the past, and we've talked about exosomes. I was at a biohacking conference in Texas last year, the Dave Asprey event, and
Hmm.
someone came up to me and asked me about fertility. So I know it's on my radar. It's just not something we put out there necessarily. I had one gentleman that had low sperm count. We had talked about doing something for him, but he didn't do it yet.
But have you seen or through colleagues or any studies that have shown even just IV, doing this with IV, that it's helped?
Uh, I've only read the abstract of some of the Chinese studies because we don't always get the
Hmm.
full article translated.
Okay.
But most of those studies speak to in, direct injection. Um, they have a lot of animal studies, so I
Hmm.
don't have information on the clinical use of exosomes personally for fertility, but I know that others have talked to me about it. So it's being done. And
Mm-hmm.
I did look it up online before we met today. And you can actually find there was a clinic in Europe that was advertising it for this
Interesting.
purpose, for fertility. Yeah.
Yeah, which I'm sure people don't really have to go all the way to Europe. I'm sure also
Uh,
if you get the IV and your body's going through this anti-aging and your, mitochondria are benefiting, and
yeah.
also which is very much linked to aging eggs.
Yep.
So you want to like revitalize and reawaken and also lower inflammation. That also helps with egg quality and sperm quality. So this is just definitely something that I found when I saw you. I was like, this is really interesting. I think that it's something that people should be hearing about. And I'm sure I wouldn't be surprised if in the future a lot of fertility clinics are going to start looking into this as well.
Yeah. No, the one that was advertising it is a international fertility group, I think,
Hmm.
in Eastern Europe, and they specifically have a webpage on this. Now we can't have those web pages here in the
Hmm.
U.S. because we are
Right.
not yet approved for marketing claims.
It's so interesting how,
Yeah,
how all that works.
yeah,
But yeah, this is great. This is a really interesting topic and really great information. I love like cutting edge stuff. I love that it's kind of like to be continued because you're still
yeah.
like, you already have learned so much, but of course, there's so much more coming, which is exciting. I find it really exciting.
I do too. I have this renewed interest. I'm a self-admitted nerd, so gets me back into things that are very exciting, and I don't get to do the
I love
same
that.
thing day after day anymore. So that's good.
Yeah, for sure. So awesome. So for people who want to learn more about you and what you do, how can they find you?
Check out Recelebrate because you're celebrating the renewal of your cells. That's spelled RECELLEBRATE. And that is our website is recelebrate.com. Instagram is Recelebrate at Recelebrate. LinkedIn, Pinterest, YouTube, but just type in Recelebrate, you'll find it.
Awesome. And you'll find it also in the episode notes. So I'll share all the links in there as well as information about Dr. Jeff. So this was a great conversation.
Yeah.
This is really, really great. And I appreciate you coming on and explaining it so nicely and really breaking it down for us, people that don't have that background. So thank you so much for coming on today, Dr. Jeff.
It's been my pleasure. Thank you for having me.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.